an op-ed from Medscape just a couple days ago saying this could go down as the worst health crisis and the worst handling of a health crisis in U.S. history. Tell us about that.
Right, Meg. Well, I don't think there's any question about that. The problem is the 45 days, the critical lack of response. So the first patient in the United States was diagnosed in Washington State January 21st, the same day as that in Korea. And we didn't have essentially any testing for the 45 days, and that allowed for this massive spread throughout the country. And so now, even though there's a surge of testing, it's so late, and there's been so much extraordinary infectivity throughout the U.S., and we're seeing hot zones, of course, in many different cities. So, as you pointed out, there is a lot of testing right now, but the critical period was missed, and that difference is South Korea contained the outbreak. They flattened the curve very, very quickly. They had very limited number of deaths. They had extensive testing, whereas we are going to see, of course, a big toll in deaths, and we were the epicenter of this pandemic.
What more do you think the U.S. needs to be doing now, even after that missed time? Can we be doing better on the response currently?
Well, there are many things we can do, of course. We can't have a defeatist attitude. And I think the main thing is we can't just rely on testing because it's so late and because there's such a high rate of people who are either asymptomatic carriers or have indeed been hit with COVID-19. So one of the most important things that we're not doing is digital tracking and tracing. And that is to use the things that people wear, like their smartwatches or their phones or taking body temperature. These digital tracking tools can tell us where the next cluster of people are starting to have either abnormal resting heart rate, like the study we just launched last week, or body temperature increasing, or other signs before we have another hot zone. And that's something, if we got a large number of Americans involved, we could stay ahead of this and know where and when something was erupting.
Dr. Topol, Tyler Matheson here. My question is, what accounts for the fact that we were so slow to get moving on the test? Do you lay it at the feet of the federal government? Do you lay it at the idea that when the WHO was using a certain kind of test, we rejected the use of that test and chose to go our own way? And then the second question, if I might, is why has the incidence in China been as low as it has? Is it because they're not testing as many or as well, or what?
Well, hi, Tyler. I think the first point is that we were the only country in the world that rejected the WHO test. And so, as I mentioned, in South Korea, they used that, at least initially, until they got a quicker turnaround test. And every other country used that test. But we rejected it and never had a test in place that could be done accurately and at scale until right around the 45-day point after the first patient here. So that was a terrible breach, and that will account for a lot of unnecessary deaths going forward because we didn't get ahead of this. As far as China, the main point there is they contained their outbreak largely to the province where Wuhan is. And so instead of the broad geographic spread that we're experiencing in the U.S., they went into draconian measures of anti-mobility. And, of course, they have ability to do that better than we do in the U.S. But that led to the containment. There was a big death toll in China, and there were a large number of cases. But we are going to exceed all of that, perhaps even orders of magnitude, because we didn't take the steps by testing, by containing the outbreak in the early days, and then even the social distancing. The other point I want to make about China is it did practice the WHO guidelines as quickly as it was possible, not as quickly as South Korea. But so they did get into massive testing. They did get into tracing contacts and isolating them and quarantines and social physical distancing. these are things that we have not done. There hasn't been contact tracing. There hasn't been, only in recent days and weeks, physical distancing. And so these are differences between the countries in Asia, not just China, not just South Korea, but Taiwan and Hong Kong and Singapore. So, they're pretty striking differences. Perhaps that's partly because they were SARS sensitized in Asia, but there are other factors involved as well.
Well, Dr. Topol, we really appreciate your time, and we'd love to stay in touch with you to hear more about that study on wearables that you're doing. Thanks so much for joining us today.
Sure. Thanks for having me. Bye.
Lost 45 days of testing. It's amazing. It's too bad.